It started out really subtly. My mom was always social. She became a little bit more withdrawn, but we thought, well, maybe that's just aging,
Symptoms of dementia can come on gradually, and sometimes they're difficult to recognize for what they are. But over time, the signs become clearer and undeniable.
She couldn't tell time. She really couldn't deal with money. She had Alzheimer's.
This is the Alzheimer's Podcast. I'm your host, Michaela Arneson. Alzheimer's affects at least 30 million people worldwide, not including, of course, friends, family, and other loved ones. And that number is growing as we live longer. In this series, we'll talk to health experts and people dealing with Alzheimer's about symptoms and causes.
One risk factor for Alzheimer's disease is having a positive family history.
We'll hear about existing treatments and ongoing research into new therapies.
In addition to the standard medications, there are also new medicines being developed in clinical trials.
We'll talk about ways you can lower your risk of developing Alzheimer's or any form of dementia.
Engage in regular aerobic exercise. Make sure you get adequate sleep. Participate in social activities.
And discuss how carers and loved ones can cope with Alzheimer's too.
I had to figure out how to not feel sorry for myself, really, that my life wasn't turning out the way that I thought it was going to be for myself or for my mom.
This series is not a substitute for formal medical advice, diagnosis, or treatment. And if you have any questions about a medical condition, talk to your qualified healthcare provider. The Alzheimer's Podcast is part of the Health Unmuted audio library by Mission Based Media. Listen and follow on your favorite podcast player, and visit our website, healthunmuted.com, for more information and share the Alzheimer's Podcast with the people in your life.